an inquiry comes into one's mind that if we have brushed so nicely, do we need to still use the dental floss and interdental brush? Before I take up the dental floss and the interdental brush, I would like to tell you that tooth has got this surface. This is towards the cheek. This is called buccal surface, and this is towards the tongue. That's called the lingual surface. And another surface is on the top with which we chew. It is called occlusal surface. The brush technique that we have described cleanses this surface and this surface. But tooth also has two more surfaces. That is the distal of this tooth and the mesial of the same tooth. Similarly, this tooth's distal, this tooth mesial. These two surfaces are called proximal surfaces. I just rotate to show the proximal surfaces. Look, they are as big as the buccal, that is this side, and the lingual surfaces. And we are not brushing. Look, this is how we have to clean these surfaces, and the gadgets to see to clean this is dental floss and interdental brush. In this particular case, this tooth where I am pointing out is rotated, and you can see the proximal side, that is the mesial side of this tooth. Whereas the other tooth behind it, we cannot see the proximal surface because they are in contact. Ratio of proximal surfaces vis-a-vis other teeth surfaces in a mouth. Supposing we have 28 teeth in a mouth, in that we have 128 surfaces. Out of that, 45% are the sides of the teeth, that is the proximal surfaces. For these surfaces, we need to floss and also use proxabrushing, which I'll explain. The floss is available in the market in the form of a reel packed in a container like this, which can open. It has a thread which can be stretched like this to a convenient length, and then it also has a cutter so that it can be cut, and for packing it can be just pressed and closed. Now I will demonstrate to you how to use the floss. You will recollect that there is a sulcus where the tooth and the gum meet. So it runs all around the tooth. The small stretch is then pushed into the space, and it is done like this. The important thing is that you should not go with a thud, otherwise it will hurt the gum here. We floss to remove the bacteria, and the bacteria can be removed only if you stretch and bring it, rubbing it from up to down in the upper teeth and reverse for the lower teeth. Floss is also available stretched on a small handle for easy maneuverability. Now the floss is taken below the gingival sulcus, and then it is stretched and rubbed from up and down, to take out the material. And once this is clean, after 3-4 strokes, then it is taken to another tooth, that is the lateral incisor, and it is stretched like this. And after this, it's just taken out. The care should be taken that when you enter into the tooth, it should not be forced into and make a thud like this. No, it should be gradual. For example, like this seesaw movement, and there should be no hurt on the gum. Look, I'm doing it again. And taken out. And similarly now here. once you practice, it doesn't take time. And if it bleeds, as it has bled now here, the patient is told to practice this every day, and in 2-3 days the bleeding will stop. If there is an excessive bleeding, then you have to come to the dentist and get it treated. Same as floss, it will go into this space, right? If it is not going, then start using floss for the time being. Now, here, it goes in. Here, what you do is, you go below the gum. Now do it like this. And bring it out. Now look, how much the thing has come out. So this is very essential along with the flossing. Doing it here, it goes into this space, this sulcus. Look, like this. Can you see? Going below the gum. Bring it out and do the other side. Now this tooth is clean. If you have bleeding like this, do it religiously twice a day, and the bleeding will automatically stop. Bigger brush so that it rubs on this side and this side together. No, we use a smaller brush because it can go into the sulcus. Sulcus is on both sides, this side as well as on this side. If you use the bigger brush, it won't go in, it will just clean up. It's essential to use a size which is smaller. Why floss as well as interdental brush is necessary? Because the interdental brush does not clean the contact area between the two teeth. And bacteria are very small, they don't need space. They create cavities here at the union. So floss will clean this contact area also, whereas this will go only for the gum. The end message is that the use of interdental brush and flossing is absolutely necessary to clean the thorough cleaning. Otherwise, the brushing that we do normally without using these methods is not sufficient, because in that case we are cleaning only the 3 surfaces out of the 5 surfaces of the tooth.